There are many non-covalent BTK inhibitors, but I will be focusing on Pirtobrutinib. That's where we have the maximum experience. And I will be talking only about the data that we have at MD Anderson Cancer Center. So among the 26 patients we had treated with CLL, 23 are eligible, and within those 23 patients, 14 patients had disease progression within the first 2 years. And most of these patients have second site mutations. And generally, it is the T474I, which is the gatekeeper mutation, either the acquisition of that or expansion of that. The other mutation is L528W, which is also in BTK, and that is prevalent in most of these patients. These patients were previously treated with covalent BTKi, so at start or at baseline, they do have C481, generally S, but sometimes C481R or F mutation also. And interestingly, those C481 mutations were eliminated or greatly reduced. So it appears that the mechanism is second site mutations. However, that's not the whole story, because we do have patients who develop disease progression, but they still have wild type BTK. They started with wild type BTK and maintained that wild type BTK even at disease progression. So we have much more to learn for those patients.